Hello and welcome to Healthy Nation. I'm Pat Murphy. The human reproductive process is delicate and complex. It can seem like an absolute miracle when a new life is born. Whether you're trying to conceive or not, the key to family planning is knowledge and preparation. In this segment, we'll shed some light on how reproduction works, and we'll give you some tips on how you can help guide the process. Let's go to Dr. Isabel Blumberg with an overview of how reproduction works.
Each month, a woman's body goes through a cycle to prepare itself for a potential pregnancy. This cycle is called menstruation, and it lasts on average 28 days, but it can vary, lasting from 21 to 35 days. The menstrual cycle actually begins when the uterus sheds its lining through the vagina, resulting in what is commonly called your period. So the day bleeding begins is day 1 of your cycle. At this point, hormones from the brain trigger the development of eggs in the ovaries, which in turn produce estrogen. Only one egg fully matures within a protective sac, known as the follicle, and it continues to produce estrogen. This estrogen causes the lining of the uterus to thicken and to prepare for pregnancy. The mature egg is expelled from the ovary about 14 days after the cycle begins and starts its journey down the fallopian tube. Throughout the month, a woman's cervix produces mucus. At about the same time the egg is released, the cervix produces additional mucus. If a woman were to have sex at this point, this mucus would help nourish the man's sperm and help move them towards the egg for fertilization. If fertilization occurs, this newly formed embryo will travel down the fallopian tube to implant in the uterus, and pregnancy begins. If fertilization or implantation doesn't happen, the cycle begins again, and the egg is flushed out when the uterus sheds its lining at the beginning of a new menstrual cycle. Each step of this process needs to fall into place just right for pregnancy to occur. Women hoping to conceive can increase their likelihood of getting pregnant by learning about their individual cycle and knowing which days of the month they are most fertile. If you are trying to become pregnant, you can consult your doctor. She will help determine your ovulation time and address any specific health concerns you may have. If, on the other hand, you are sexually active but don't want to become pregnant, there are many birth control options available. These include the barrier methods, hormonal contraceptives, IUDs or intrauterine devices, natural family planning techniques, and permanent surgical procedures. You'll want to talk to your doctor about which might be right for you and consider the risks, effectiveness, and your lifestyle. By knowing how pregnancy works and by learning about your individual cycle, you can better plan and prepare for your future.
It's important to learn about your body and to know your options when it comes to family planning. For more information on pregnancy, birth control, or sexual health, watch our other segments in this area. Thank you for being a part of Healthy Nation.